Hello, I'm Steve, back here with Dr. Nario for our health and wellness cereal. Yeah, don't eat cereal. Series. So anyway, today we're going to talk about cholesterol. So, Dr. Nario, what is cholesterol?
Well, good afternoon to everybody. Good afternoon, Steve. Thank you for having me again. So let's start with cholesterol. What is cholesterol? Cholesterol is a waxy substance, but we have this misconception that cholesterol is always bad, but it's not really. And I'm going to get into the nitty gritty as we go along with this. We actually need cholesterol in our body to build our cell membranes. And also, too much of this becomes a problem. Now we go to the sources of cholesterol to make it easier for you to understand. Actually, liver. Our liver makes our own cholesterol on what we need, and they derive it from food that we put in our system. Food from, number one, dietary sources would be animal sources, meat, poultry, and even dairy products. But at the same time, plants also has cholesterol in it. That's why there's a good mix of contribution between these two sources on our own body cholesterol. But the bad stigma that I want to clarify with cholesterol is we always think about it connected to heart attacks and strokes. And the thing here is it's not just that. As I mentioned to you, there are good usage of cholesterol in our system. When I mentioned about the cell membranes, we use cholesterol for that, but also our hormones, such as cortisol, when we use it for stress response, and also reproductive hormones such as testosterone and estrogen.
Okay, so are there different types of cholesterol? What are they?
There are. In general, I'm going to discuss this, and also I would just probably correlate this with the common understanding of the general public about cholesterol. Oh, cholesterol is actually the best way to remember it is the good, the bad, and the ugly. Why is that? So let's first discuss the bad one, LDL cholesterol. We always see this in our blood tests. This is the one that's what we call the bad, meaning it contributes to the fatty buildup of cholesterol in our arteries. The next one is the good one, is just what we call the HDL. HDL is good cholesterol, meaning it's the one that's protective. It actually carries the bad cholesterol out of your system so that you can have better circulation. And also, this also helps with the liver remove cholesterol faster out of your system. And the last one is triglycerides. This is the one that we actually consume the cholesterol and it becomes storage fat in our system. And this is the stored excess energy from our diet most of the time. And that's why this is the good, the bad, and the ugly, because they have all different contributions in the accumulation of cholesterol in our system. And the thing here is bad cholesterol, again, you have to remember, is the LDL. The good one is the HDL. It's a bad situation to be in when you have too much LDL and you have low HDL. And this increases the risk of buildup of cholesterol plaques in our arteries, thus decreasing the blood flow to our specific organs. And when you hear this, this is when you correlate heart attacks and strokes being a higher chance of happening for you. That's why, how do we find out? Is through blood testing.
Okay, so is there a good cholesterol balance? And what are some of the risks of having a cholesterol imbalance?
Yeah, the risk here is we have to understand first the contributions of what made the imbalance. So number one, the most common thing that we hear is genetics. When family history comes into play, that somebody in your family tree has high cholesterol issues, histories of heart attacks, strokes, hypertension, diabetes. These are all clues that you might get it because the gene might have been passed on to you, or if you have these specific diseases as well, you are also predisposed higher to the ones that are healthier in having cholesterol issues. But the thing here is, I want to make sure I embed in everybody's understanding that Having a genetic predisposition doesn't mean that you're going to have it as well. This is where we come in. This is where we do preventive medicine, wherein we play around with your environment to make sure that you do not express that specific illness. And it's called, in the term of epigenetics. And we will discuss more about that, and that's a whole another topic. And the next one would be acquired. This is smoking, alcohol, sedentary lifestyle, a diet that is bad, a Western type of diet, Western US type of diet, as we call it. And these are foods that are high in saturated fats, trans fats, refined carbohydrates, and also all these fats actually contribute to make the liver create more cholesterol for you, and this becomes unhealthy. Basically, I just described your fast food and dessert meals that is part of our favorite lists as well. And I want to mention about tropical oils such as palm oil, palm kernel oil, and even coconut oil, which we think is healthy, also are contributory oils that are bad for our health. And the best proven diet, since I mentioned about diet a while ago, would be the Mediterranean diet and plant-based diet, and include the DASH diet as well.
Okay, so how do we know if we have an issue with our cholesterol that we need to address? And does high cholesterol mean it's always a problem, or how do we know with the cholesterol problem?
That's a good point, Steve, that you brought up there, because I see patients always concerned about, oh my God, my total cholesterol is high. It doesn't mean that when you find that out in your blood tests that you are doomed for illness. That's why we need to break this understanding or misconception about that. We need to go into deeper details. How do you find out is you go to your regular doctor, and they will actually request, this is the most common way how they find out, and your doctor will request a lipid profile, as we call it. So they would look at the good, the bad, the triglycerides, and the total cholesterol there. But the problem here is this is old science. With these numbers that you see in your common lipid panel, this does not tell you anything at all about risk of heart attacks and strokes. With our patients, and as we handle cholesterol issues in our clinic, we actually do a special testing. This is called advanced lipid testing, wherein it's a deeper examination of these numbers, where when we look at the sizes, the particle number, the distribution of how big, how small your bad and good cholesterols are, and these are the ones that really makes a difference. And this will give you a better preview if you are more prone to heart attacks and strokes. And you can actually ask your doc also if they can request for an advanced lipid testing. Why I bring this up is because I've seen in the practice that I have a normal lipid panel, and suddenly patient after a few years suddenly develops a stroke and a heart attack. And vice versa. You would see the craziest, scariest numbers on the lipid panel, and the patient does not even have any risk of developing heart attack and stroke. That's why we have to apply new science in our practice and let your doctor be educated about looking for these specific details.
That's very interesting. So if we have cholesterol problems or abnormal cholesterol, is there supplements, anything natural that we can take?
Yes, of course. The thing here is, as I give you this suggestion, I want to just give basic doses of it. For the reason that when we see patients in the clinic, we actually give super therapeutic doses, meaning this is out of the recommendation. I mean, not out of the recommendation, but it's something that needs medical supervision when you take higher doses of these supplements. But in general, I'll give you a rundown of something that you can do on your own for now as starters. Number one would be omega-3s. You always hear that. These are coming from, majority of them would be coming from fish sources. And you have to make sure that you get a good omega-3 from a good source, meaning that source should have less heavy metals in them. You've heard about rancidity, about omega-3s. And if you have that specific effect, like when it smells, when you bite on it, or if you get bloated, you burp a lot, that's not a good sign. And you have to be conscious about the EPA DHA level of your omega-3s. And this is also good for high triglycerides, and 950 milligrams to 1 gram is the best dose to take at least once a day. The next one is niacin, which is B3. I would always suggest you get the sustained release version of niacin and be aware of the flushing effect, which can sometimes patients describe this as I'm turning beet red, but that's an effect that can actually be preventable. How do you do that? Take food with your niacin. And also the minimum dose can be 250 milligrams a day. Another one is vitamin E. Vitamin E is tocotrienol or tocopherol. The best thing that I can suggest to you for this is look for the component gamma delta tocopherol. That's the best type of vitamin E that you can take for cardiovascular problems. And you use this with your omegas, so because they have synergistic effects that are more beneficial for you. And take it at 200 milligrams per day. Another one would be berberine. Berberine is an alkaloid part of plant roots, rhizomes, and stem barks, and it reduces cholesterol absorption. That's how it works, how it lowers your cholesterol numbers. And it works well with red yeast rice, and 1 gram in divided doses the whole day is a better approach to take it. And lastly, the famous red yeast rice. This is a fermentation product of rice, and it's almost compared to a statin. It's called the statin-like supplement. And the active product of this is called monocolin. And you have to make sure that you get a good source of this one for the reason that you can actually get renal failure from contaminated sources, which has citrulline. And that's why you have to get it from a very reliable place or source. And the recommendation, 1,000 milligrams a day.
Wow. Thank you, doctor. Very good information on cholesterol. That's Dr. Nario from Biointegrative Health Center. Biointegrative Health Center is in Reno, Nevada. If you have questions or you want to find out what they do, you can check out their website, Biointegrative Health Center in Reno. So thanks again, doctor, for your time, and we'll see you again next week.
Thanks, Steve.